Good afternoon and welcome. Thank you for being with us today. My name is Holly Gall, and I am Senior Executive Director of Development and Communications for UNC Lineberger Comprehensive Cancer Center. We are so glad you are here with us today for this virtual event. Cancer has touched so many lives, and we appreciate you being with us to hear from some of UNC's leading experts in cancer treatment and care. You also will hear from some of our patients at UNC who will share more of their journey. Even though this is a virtual event, you will have the opportunity to ask questions at the end of our presentation. Please feel free to use the Q&A function throughout our discussion. I am pleased now to turn the presentation over to Dr. Matt Ewend, who is president of UNC Physicians and the Van L. Weatherspoon Jr. Eminent Distinguished Professor. Dr. Ewend is also a neurosurgeon in the Department of Neurosurgery here at UNC. Dr. Ewend.
Thank you, Holly. Good afternoon. My name is Matt Ewend. As Holly said, I'm the Chief Clinical Officer for UNC Health, and I'm a professor in the Department of Neurosurgery at the UNC School of Medicine. The mission of UNC Health, our 14 hospitals, more than 2,500 physicians, more than 25,000 teammates, is to improve the health and reduce the suffering of the people of North Carolina and others that we serve for this generation and those that follow. This generation through the care we provide each day, and future generations through the research and education that we perform. We have 4 key values: leading the way, it starts with me; Carolina Care, which is our commitment to patients; and one great team. Of course, UNC is loaded with great teams. For example, one of them played really well in New Orleans in basketball recently. In the few minutes we have together, I want to share with you how grateful I am to be part of a great UNC Health team. In my career, this is the work that's been the most meaningful for me. I'm proud to be a member of the UNC brain tumor team for now almost 25 years. From our frontline clinical team of nurses, doctors, psychologists, pharmacists, administrative staff, and many others, to our research team in both clinical and basic sciences, we work together with a single purpose: give each patient world-class treatment and be sure that they know we care for them as a person while we're caring for their tumor. I want every patient, regardless of how challenging their medical condition may be, to have a strong faith that they have the best team, and to know that each member of the team has a single focus: helping them. For patients facing difficult diagnoses, having an unwavering faith in their care team can be a great comfort. We work together every day to earn that trust from our patients. And when a patient expresses gratitude for the efforts of our team, it's deeply rewarding for me, and I know for every one of our team members who are on this call. I'm pleased now to introduce Dr. Michael Catalino, who's the Chief Resident in Neurosurgery. Next year, Michael will begin his fellowship in brain tumor treatment at the MD Anderson Comprehensive Cancer Center in Houston. He's one of the rising stars in neurosurgery. Dr. Catalino will introduce our terrific guest speaker. Michael.
Thank you so much, Dr. Ewend. Hello, everybody. It is my great pleasure to be here and to join this excellent team and all of you in hearing from Christina Costa. Christina comes to us from the University of Michigan, where she has a really long, wonderful career. She received her BA in biopsychology, cognition, and neuroscience in 2015, her MS in psychology, specializing in personality and social context, and now is a doctoral candidate. And she joins us as a TED speaker who's given so much inspiration to people like me, a physician, and to so many others who I've shared her talk with. Christina, the first time we spoke, the 3 things that really struck me about you were your lively personality, your care for teaching, and all of the wonderful advice that you gave me. Even though we just met, you never ceased to take advantage of an opportunity to share your story to inspire others. So thank you so much for joining us. We're looking forward to your talk today.
Thank you so much. What a beautiful introduction. I'm going to go ahead and share my screen with you all. And someone could just give me a thumbs up that they see what I see. That would be wonderful. Thank you, Dr. Catalino. So I'm so excited to be with you here today to be sharing some of my life and also some of my research. This is truly a combination of two big things happening in my talk today, a micro talk called Neuronarratives, Experiencing Resilience with a Brain Tumor. I'm quickly going to go over my background with you all, some research in resilience, and then go over the methods and the results of the study that I'm presenting today. And I believe later on there is a section for Q&A. So I always load the question, where are you from? Because I'm from a lot of places. I was born in Germany. I moved back to the US in Michigan. Michigan has been our home base. I was in Australia for middle school, back to US, Brazil for high school. And I came back to the University of Michigan to study neuroscience. I then took the advice to teach, and I taught middle school science for a couple of years, which was anyone at home with middle school age children who's interacted with middle schoolers knows that it is a challenging but rewarding time. I loved that. And then I had a mentor who was doing some work in psychology around the area of well-being in professional and organizational settings. And so I came back to the University of Michigan, where I have been ever since, pursuing my doctoral degree. And I study resilience and well-being broadly, and more specifically, I study that in the context of teaching, which right now in particular is a really important topic. I also get the joy and privilege of teaching at the university level. So I started out teaching intro psych and have taught research methods, developmental psychology at University of Michigan and another university close to home. And I absolutely love doing that. That is what I will be pursuing next year. Hopefully around this year, next time I'll be graduating and then teaching full-time after that. The other side of my brain story begins in 2019. I started getting very strong migraines in November of 2019. My dad has migraines, didn't really think much of it, other than it was just my time to be getting these really strong, heavy migraines. Those got progressively worse, and I started experiencing other symptoms with those, like blurry vision. Saw several doctors just saying, I'm having strong headaches, migraines. I'm getting aura with my migraine, which again also is not very uncommon. Saw an eye doctor, regular physician. And then when that started being paired with some left side numbness, and I brought that up to my physician, the suggestion went from, you should take Tylenol, to, we should probably get you in to see a neurologist. I got in the soonest I could, which was later that year. Then summer of 2020, I started just feeling very dizzy, very faint, which we now think were focal seizures. And when you call a neurologist or send them a portal message and say that you're starting to feel dizzy, they really get on it. And I got in June, had a virtual neurological exam, and they ordered an MRI. I was so excited to get the MRI because in intro psych, we teach about MRIs and fMRIs. And I thought, oh, this is going to be so cool because I can show my students my own brain on my slides. Got the MRI, but then got something that was not so great, which was a call from my neurologist at 11 o'clock at night. I thought, this can't be good. And I was advised to go to the emergency department. So that's where I saw the image for the first time. That is here. So I was diagnosed then in the emergency department with a suspected glioma in the right hemisphere of my brain. It was in the frontal temporal and then deep into the insular regions. And that was a very bizarre feeling, having seen these brain images so many times and seeing my own and seeing something that obviously should not be there. I remember talking to the nurse, and I just said, I was by myself because it was peak of COVID, and very nervous, sort of blabbering on. And I just looked at her. I said, "Oh my God, wait, I have a question. They're gonna schedule surgery, and I'm gonna have to be awake during that surgery." And she said, "Oh, honey, have you been watching Grey's Anatomy?" I said, "Yes, every season, every episode, but answer the question, am I gonna have to be awake?" And she said, "Well, most of the time, yeah, but it's for your own good, and it's not gonna be painful." But that was just sort of a like coming moment of, this is what's happening. This is real. And so that month in August of 2020, had more imaging done, met with neurosurgery, met my neurosurgeon for the first time. We scheduled surgery for September. I had a 13-hour awake craniotomy with safest total resection, meaning getting out as much of the tumor as possible with optimizing my life. My surgeon wanted to get out 70%. He got out 97% of the tumor, which was great news. The following week, I was diagnosed with an anaplastic astrocytoma. So that's a grade 3 brain tumor. And that's when I met with neuro-oncology for the first time, went to the cancer center for the first time. I also did some embryo preservation. So then in November, before I started treatment, I had my egg retrieval, a couple more MRIs and radiation simulation. And then I went through pretty typical treatment for a high-grade glioma. I did 6 weeks of chemotherapy and oral chemotherapy every night and radiation during the weekdays. And then I followed up with 12 more rounds of that oral chemotherapy, which was 5 days of taking the oral Temodar at night and then waiting. I'm happy to say that I finished that in February. I am done with that. And now I am on the scan and watch and wait cycle. I have an MRI next week. I go there every 8 weeks and get scanned, follow up, and see my team. So the very first thing that I did in the emergency department, besides asking about my Grey's Anatomy references, was I had a lot of feelings, and the only physical thing I had on me was my cell phone. And so I opened up my notes app and I was just writing some things that I was feeling in between communicating with friends and family. And my phone was my digital notebook on that day. And I wrote this. This is the very first thing I have, and I still have in my notes app. I wrote, "My brain. She is beautiful. She is powerful. She is intelligent. She is a trespasser that is not welcome, that came without permission, just like so many other things we don't expect in life. But she is brave. And even though she is scared, she will face the unexpected. She is resilient." I kept writing. I met with a therapist almost immediately and explained that, and she really encouraged me to keep writing. And so I did. That was a big coping mechanism for me. And so even within the first month of that initial diagnosis, whenever I had a feeling, sometimes it was a phrase, I would open my phone and write down a note, sometimes a full poem, in a notebook that I would bring to the hospital, on my computer. They were sort of all over the place. And I was talking to one of my research mentors and telling her about these writings. And she said, "Have you ever heard of an autoethnography? It's where a researcher takes their own field notes and they write up an analysis on the things they've been writing about." And so in possibly one of the most nerdiest ways of coping, I decided that I was going to write an autoethnography with all of these writings that I had done over this period of my life, where I was what I felt like on pause and was going through treatment. That was my full-time job, was taking care of myself. And I had all these notes. I wanted to look through them and make something scholarly of them, because that is something that interests me. And so in looking at all of those poems, I had a couple of research questions. My first one was, how did I adapt to change? In hopes to answer the question, how do cancer patients adapt to life-threatening changes? What were the things that helped me survive and thrive? What were the things that helped me cope? In hopes of, again, answering that bigger question of what are the possible things that could help researchers, doctors, scientists to see how oncology patients and chronically ill patients survive and thrive. And so with those questions in mind, I took all of the poems that I had written from day one of my diagnosis, that day in the emergency department, to being done with that first round of treatment, which was those 6 weeks of radiation and chemotherapy. So it was approximately a 6-month period. There were 124 poems. And I kept in mind what I had actually written, and then also the context of the poem. I tried to leave notes about where I was when I had written that, what I had just heard, or what conversation I had. And I completed an autoethnography, which I mentioned before is when a researcher takes their own field notes and their own work and tries to write something about their experience. So this is really leaning into the subjectivity as a positive thing. A lot of times in research, we want to be away, we want to separate ourselves from the data. And this is certainly a qualitative type of research where it's saying being subjective is actually a good thing. I am researching myself. I know myself best. And so I can really share those things as a positive quality. And before I go over what I found, I want to share what I think of when I say resilience research. So my research in general focuses on resilience. Resilience is commonly defined in the positive psychology world as what enables people to survive and even thrive in the face of adversity. Historically, research focuses in this area, especially in psychology, we focus on the negative consequences of adversity, which we know there are lots of. But resilience research really says, well, even in the face of adversity, some people survive and some people even thrive despite those difficulties. And so what are the factors, what are the things going on there that allow people to do that? I really like to use this graphic, especially when I talk to my students about positive psychology, because, and I'll address this later too, we're not talking about, positive psychology is not the science of happiness. It is not the think happy thoughts, law of attraction type of stuff. We think about this continuum. Most of psychology focused on what causes stress, what causes anxiety, in work, what causes burnout. Well, if we remove that, if we figure out how to alleviate stress, we get to the yellow face, we get to the I'm in survival mode, when really that's half of human experience. What about then, and how do we get to the green levels? How do we understand what joy is, engagement, resilience? And so I feel like this graphic is helpful in understanding that part. When we think of my context, right? What not only allowed me to survive this experience, but where did I experience those positive things and how did I do those? So not surprisingly, when it comes to resilience research in the context of cancer, a majority of research in psychology focuses on illness and patient stress. So the questions here are really, well, what factors allow people to thrive during their diagnosis? And so what I did is I did a qualitative analysis of those poems, and I tried to find themes of what helped me cope and what helped me thrive. And after conferring with, I did this mostly by myself, and then I conferred with some colleagues. I had them read through my poems too, to make sure that I was seeing what I really knew I was seeing and that I wasn't missing anything. And I picked out 4 different themes that I'm going to highlight for you. They were trust in medical care, meaning and purpose, social support, and gratitude. And for each of these themes, this could easily be an hour-long talk. It is not going to be. I'm very cognizant that I have 5 more minutes. I'm going to just pick out one poem that was an example of that theme and discuss it very briefly with you in hopes of exemplifying these themes. We'll start with social support. Social support was a big theme, and utilizing social support. This is my baby sister hopping in my hospital bed. I think that was after surgery. Yeah. So I want to read you this poem. This one was called 404. People start to look at you differently when they realize how fragile your life might be. They don't want to call because they don't want to overwhelm you. They mostly don't know what to do. I called my friend from the ER, and she has called me every day since. At the exact same time, at 404, we laugh, we cry, we talk, we dream. She might not know that 404 saved my life. I will be there at 404 for anyone that needs me. I wrote this one probably midway through, probably 3 months after diagnosis. And this is a true story. So I had a friend that I called, and it had just happened that I had called her at 404. And so we made a joke about it. But she called me every single day. And she said, you know, when my mom had cancer, everyone sent a meal, everyone sent flowers day one, and then I stopped hearing from people. And so it was really important for me in the future to be a constant care, to be someone who shows up constantly. And that was what this poem was representing, was how much that meant to me, and how, who knows how I've reacted to people's experience in the past, but it meant so much to me that she was still there, because as people's lives moved on, mine didn't. Even now that it is part of my life, it is part of who I am. And so to have those few that sort of stick out was very, very helpful. So that's just one example of social support was a pretty big theme here of talking about the people surrounding me. My next one was trust in medical care. This is my beautiful team. I am a student at the University of Michigan. I'm also treated at the University of Michigan. I think this one, so this is my neurosurgeon. I don't know that people have this many pictures with their surgeon, but I do. I could have a whole folder. And I'm showing these pictures because this poem was about after a visit with my neurosurgeon. So this one's called Law of Attraction. It's nothing that you did, the doctor said. I hope everyone can hear that. You did not manifest your trauma. I remember very specifically writing this. It was after my pathology appointment. It was never a question of did I do something to do this? Was it this? Was it this? And it was something my doctor actually just said. He said, it's nothing you did. You didn't do this. It's a random mutation. It turned into this. People are going to ask you questions. Just know it's not that. And at the time, I didn't know that I needed to hear that. Later on, I totally understood. Then you hear people talking about, well, what about cell phones and brain tumors, those things. But I already had in the back of my mind, my surgeon telling me, this is not something I did. I did not attract this. I did not manifest this. I did not do this. This is random. And so poems like this really exemplified like these very short things that physicians said to me that obviously left a very lasting impact on me. I could talk about this one for a very long time. The third was meaning and purpose, and specifically finding meaning and purpose. So in this poem, I wrote, my only wish, give me the strength to carry this. Give me the strength to survive this. Then please give me the strength to show the others that they can survive it too. I wrote this a month after pathology came back. I describe healing as a roller coaster that has eventually, I'm on a plateau right now, but in the beginning especially, it was up and down, up and down. And I think the lowest down was the first time you hear the word tumor, you hear cancer, you hear chemotherapy, oncology. Those words are so heavy. And so post-pathology was really, really tough for me. My mom reached out to somebody at MD Anderson and got in touch with a patient panel of people and parents where they match you up with someone with your exact diagnosis. And she got someone on the phone that was a 38-year-old woman who is 20 years into her diagnosis. And she just introduced herself to me, and I started sobbing because I was very anti-Googling at the time, which I still give that advice to people. I think that was a good thing. And so just to know that there was a woman out there that is 20 years into this, to know that she is alive, I didn't need to know anything else. I didn't need to know, I mean, I did know how she was doing, how she was, but just knowing that she was there gave me the boost that I needed. And I remember writing this thinking, not only did her story save me, but I want to be her one day, and I don't see why not. And I want to show other people just by existing that they can have hope too. And then my last and final theme was the theme of gratitude. And I tie this one with self-love. And I also think that this is related to a lot of the work that UNC is doing, that Dr. Catalino told me about, that I'm very happy with and very interested in. So this is really what sparked the talk that I gave with TED. This whole theme, this idea, came from this poem. I'm not going to read it because it's repetitive, but in case anyone's in audio, I'll read the first two lines that repeat, which are just, I will keep fighting, but I will keep living, and I will keep loving. This one, followed by the following poem, was written the next day. It is called Loving Over Fighting. I am not at war with my body, the opposite. I love my body. I love it no matter what. I love it for the things it can do and can't. You're young and healthy. Your body will make connections again, but what if it doesn't? My body is worthy of loving, no matter what connections it makes, no matter how long it takes me to move, to write, to feel, to think. I love my body. It did not betray me. It was given different instructions, and I will live and love those instructions. No more wars, no more battles, no fighting. I will love it through the good and the bad, no exceptions. And I won't re-give you my TED Talk, but this theme, while it wasn't the most frequent theme, I think it's the most significant for me in something new that I learned. And it came directly out of the narrative of hearing when people then heard cancer, when they heard tumor, I became a warrior. That was the narrative. That's the thing people see in movies. And I hated that. I did not like that. And I didn't understand why for a while. And it really wasn't until reading these poems that I understood that, well, that's because I love my brain. I love my body. I want to love it while I heal. I don't want to be fighting my entire life. And so in reflecting on these themes, I think there are lots of things that we can talk about and we can draw from all of these. We know that patient trust is really important for patient outcomes. And so how can we build that trust in the medical community? There's preliminary evidence that suggests that people who seek meaning have higher levels of medical satisfaction. And so my big question there is, how do you seek meaning and purpose without forcing someone to do so or letting them do it in their own timeline? Social support is a very significant effect in predicting resilience in cancer patients. We know that already. How do we bolster social support for folks who might not have it? And then gratitude in general, we know that gratitude interventions, even in specific patients, in specific cancer patients, have positive outcomes like showing more coping strategies. But similar question to the meaning and purpose, how do we suggest gratitude interventions without suggesting that writing a list of gratitude is going to solve things, right? Like reframing that. And so I hope that this work has a lot of implications in the way that health professionals think about interacting with patients. I also hope it has implications for patients themselves. And I'm interested in all of these things. But while I'm 5 minutes over, I want to leave you with one last poem. This is from my book. I ended up publishing these poems to raise money for brain tumor research. I'm going to leave you at page 72. This one is called Renewal, and I hope it can mean something to you today. Resilience is not putting on a smile while the world explodes. Resilience is scary. Resilience is hard. Resilience is taxing. Resilience is waking up each day despite not knowing what it will bring and living it anyway. That one resonated with me today. I'll just leave you with this screen for a couple seconds. That's my email if you need to get in contact with me. I also share a lot on Instagram. I believe that's how I got the TED opportunity in the first place. So my Instagram is miss.Christina Costa. Feel free to connect with me on there. I respond to email inboxes on there as well as email. And thank you again so much for letting me speak to you all today. I'm really happy that I got to be here.
Thank you so much, Christina. Wow, that was incredible. I say, after hearing that talk, I want to just affirm some of the things that you hoped for in your life, the power of the subjective, what helps people thrive in the context of adversity. Well, people like you. In that poem that you recited, your only wish, you said that you hope to have the strength to show others that they can survive too. You have. And I know there are a lot of people on this call right now that are experiencing that. So we're taking a moment just to transition to talk a little bit about what UNC has done in this area, and also to open up to the audience to ask some questions. And so I want to start off by just saying something about neurosurgery in general. The history of our specialty has been very complicated because the risks associated with procedures we do can be significant. And Harvey Cushing, one of the founders of our specialty, said this. He said, "A physician is obligated to consider more than a diseased organ, more than the whole man or woman. He must view the man or woman in his or her world." And this is important because all of our patients and all of the patients listening today know that the context of our lives, as Christina has mentioned, are way more complicated and beautiful than anyone can imagine. And so at UNC, we care deeply for patients, and we care deeply for the context of their lives. I think a lot of us, a lot of physicians have heard, when making difficult decisions, patients may often say, what would you do if it were your parent, your sibling, or your child? I believe at UNC that the thoughtfulness and the sentiment is built into the recommendations that we provide on a daily basis. People like Dr. Ralph and Dr. Shen, Dr. Ewend, all of the great physicians who I've been able to look up to over the last 7 years of training here. And these recommendations convey one simple message, that when you're under our care, you're part of our family. And the recommendations that we provide are those that we provide for our own family. And I think this is really important. I think from the very beginning of the encounter to the time in the hospital, to the transport, whoever's doing the transport, or the nurses, or the medical assistants, the OR staff, everyone is a part of the UNC family, and everyone tries to convey the same sentiment in what they do. And so we're going to transition, like I said, into a time of discussion and questions. And I want to bring up and introduce two of my great friends, Dr. Yasmin Ralph and Dr. Colette Shen. Dr. Ralph is our neuro-oncologist, and I remember the first time we sat together at Starbucks to meet, and we got to reflect on why we were here, why we were doing what we were doing, and how we chose our specialties. And I think that in a lot of ways, we couldn't be more similar in the deep care that we have for patients. So thank you so much for being here, and thank you for taking the time to answer some questions. And Dr. Shen, I think the first time I ever heard your name was actually, it was at Brain Tumor Conference, and your intellect and the thoughtfulness that you use to approach really difficult decisions for patients. It just, it just was so inspiring for me because, you know, in training, a lot of times we don't get to see a lot of these really complicated situations borne out in the thoughts and minds of our colleagues. So thank you for your compassion, and thank you, Dr. Ralph and Dr. Shen and everyone else for participating in this webinar.
Thank you, Dr. Catalino, and thank you, Dr. Costa, Christina, for your inspiring talk and sharing your story. As a physician, I found that I've learned the most from our patients, and I'm so grateful to hear the perspective of patients like Christina, and to have the opportunity to work with and learn from our patients every day together with this great team at UNC. It really is a privilege to work with this team here. We are so pleased to have two of our patients who have undergone treatment for brain tumors here at UNC and who have generously agreed to share their stories with us today as well. I'd like to introduce Blake, who had surgery and completed radiation for a brain tumor almost a year ago at this point and is now undergoing chemotherapy. Blake has been such an inspiration to us with an amazingly positive attitude and staying super active, serving as a health coach. And so, Blake, if you could just share a little bit of your story with us, that would be great.
100%. Thank you for that intro, Dr. Shen. As Dr. Shen alluded to, my name is Blake, and I've been receiving treatment at UNC. A little bit of my background with brain cancer is that I was actually living and working in Massachusetts at the time of my diagnosis. And I had, you know, similar to what Christina was sharing, I had been getting progressively sicker with nausea, vomiting, migraines, and all that lightheadedness type of things. Progressively, it had gotten worse over about 4 months until it got to the point where I wasn't able to eat or drink anything. I almost passed out in the shower. You know, I didn't eat or drink for 3 or 4 days. And I eventually had to call an Uber to go to the ER. And thankfully, they just went ahead and did an MRI for me because it was already that bad. But needless to say, after that MRI, and they have found what they were calling a cystic mass at the time, it was less than 12 hours before I had to get my brain surgery. So the first time I even saw the scan was I was on the stretcher getting an IV for the anesthesia. And I had just saw the scan of what was in my head, which was, you know, a massive brain tumor in my right frontal lobe. And then just had to be wheeled in for an 8.5, 9-hour surgery. And as I said, I was in Massachusetts at the time. I had to quit my job. I moved back to North Carolina to be closer to family for the rest of that treatment. After I found out that, you know, after the surgery, I found out it was cancer, and have been going through that process. I had about 2 or 3 months of radiation, 6 months of chemo, and I'm thankful to say that I finished chemo actually in December and been having just follow-up scans for now, just sort of in that wait and watch period. And overall, doing great, have great support here. You know, I ran a 10K on Saturday and I'm looking forward to doing more stuff. And Dr. Shen, of course, and Dr. Ralph, and before Dr. Ralph, Dr. Hagi were always super encouraging with, you know, my practices of yoga and everything to stay positive and active during treatment. So very grateful.
Thank you so much, Blake. I think Dr. Ralph will introduce our next patient.
Yes, you know, so our next patient, Neil Umar Singh, I've only known him for about 6 months. And even before I met him, you know, when I was looking through his chart, the first thing I noticed about him was that he had a very unique name. And Neil Umar Singh, I thought that was very cool. And I was looking through his notes and I realized that he had a grade 4 tumor. when I looked at his name and age, and he was so young, I wasn't expecting that I look up the path and it would be someone with an aggressive tumor. He was young, and so I went in to see him, and he greeted me with the hugest smile the patient has ever given me. And I wasn't really expecting that. He was young, he had an aggressive tumor, and he was on chemotherapy. He was coming in with an MRI. I was expecting someone that would be anxious about, the MRI he had just done and what the results that, would be. And since November to now, I've realized that every time he's come in to see me, he's so positive. He's such a good son. I've met his mom, and then he's such a good husband. He loves to talk about his children, and he's always so positive. He never complains. He has never had a complaint. And when I was asked to talk about a patient that personifies resilient, he was the first person that came to my mind. And so I talked to him and asked him if he would share his story here, and he agreed. I'm very grateful to him for that. Neil, are you on? Would you like to talk about your story?
Thank you for all of that. Right now, I'm currently going through everything that Christina and Blake has been going through. I haven't hit that part of the chemo and everything, to where it's just doing the MRIs and just taking it every 8 weeks and seeing how everything goes. But right now I'm currently active duty military. I just finished my retirement due to the tumor and everything else. My service members that I work with, my soldiers, my family, friends that are really, they're the ones that's really helping me through all of this. It's hard to even talk because it gets me emotional, because I'm still currently going through it. It's only been a year, 2 months after I got diagnosed, found out my wife was pregnant, and we just had our baby 2 months ago. And that right there is what's keeping me going right now. Just to know and hear all these stories from everyone else it's amazing what people do and how things work and everything like that. And I do appreciate everything that UNC has done. Dr. Shin, Dr. Ralph, Dr. Hagi, he started it all off with me. He put me on a good path, and then I had Dr. Shin and Dr. Ralph just continue with that. There was no negativity or anything. Everything was always positive. Every time I see them, I do have a smile. I stayed there long enough to where they got to go see another patient for me to leave. But I enjoyed it all, and I'm still enjoying it. I'm just looking forward for everything to move forward with my family, with everyone there. But honestly, that's my story right now. I'm just taking everything day by day and loving everything that's going on right now.
That's what I love about Neil. And I know we have several people who have logged in and are listening to the seminar, and I don't know if they believe their ears when they say someone like Neil say that he has enjoyed it. But it's not unusual to hear these kind of positive words from our patients. And Neil, I just want you to know that it's your attitude and it's patients like you that make us want to come to work every day, because it's so it's I don't even have a word for it. I don't know what to say when you say that you've enjoyed all of it, but just that you're such a wonderful person, and you give strength to us to take care of all the other patients we see that day when you come in.
I can absolutely say the same thing about Blake as well. But both of you, it's, the smile, the energy, the enthusiasm, it really kind of connects with all of us, the other patients, the other healthcare team. So thank you both very much for sharing your stories.
There's a couple of questions in the chat. I don't know if, I guess, would you like us to answer them for everyone to hear, or I just was thinking maybe we could answer some of them. I think you're muted, Allison.
I'm happy to go ahead and get started with this portion of our webinar. We do have a few questions for many of you, and we wanted to say thank you so much for sharing your story and for your insight and perspective. This is why all of us do what we do, so we can help so many patients and care for you and for your loved ones. So I'm going to get started with the first question. Let me just pull that up, and that is going to, just one second. What is the best way to begin the practice of positivity? And this is for you, Christina.
I think when people are interested in starting gratitude, there was this very seminal study. One of the first studies of gratitude was they were doing an intervention where they asked half the people to reflect on their day in a journal, and then have people to pick out 5 things they were grateful for and why they were grateful for in a list, which is now called like gratitude listing. And over time, the effects of the people in the group who were reflecting on what they were grateful for in their day, their happiness went up, their depression went down, their anxiety went down. I mean, just like robust effects. And so I always teach, this is something that is so easy to do. But even my students joke, because one time a student said, well, do you do it? And this is years ago, I was like, oh, you got me. I do it sometimes, but we tend to do these things when we are in crisis mode, like when we need them. So I always say, like, everyone should be doing this, and make it easy for yourself. Get a fun journal that you look forward to writing in. Set an alarm. I set an alarm at night. I like to reflect at night. And then in some phases of life, I feel like it's fun to do in the morning. Do it with your coworkers. Were you grateful for within the past 24 hours with your family at dinner? I feel like that is a really easy way to start gratitude practices.
Thank you, Christina. I'm curious if you would mind sharing from your perspective, would it be important to work with a therapist, or have you found that to be helpful for you?
I'm a psychologist, so I've always been team everyone should be seeing a therapist. And I remember I was seeing a therapist. I started seeing a therapist at the beginning of the pandemic, and we were talking about like academic work and all of these things. And then after the emergency room, I called her and I was like, we have got way bigger fish in the sea, like way bigger issues, like forget about the advising stuff. We now are going to be talking about this. And she was really instrumental. My biggest advice for people starting to see a therapist is it's okay if the first person you see is someone that, like, if you don't mesh, like, we pick and choose our friends, we can pick and choose our therapist. I really encourage people to try a couple of different people and then pick someone. But I definitely encourage that.
Thank you. And one other question that's for you. Would you mind sharing the name of the audio recording app that you mentioned during your talk?
Yes, which one? Audio recording.
I think it was an app that you had mentioned that you found that was helpful for you.
If you're talking about, I think I said my notes app.
Oh, okay. That might have been it.
So the notes app is just what comes on, I don't know what the equivalent is for Android, but on iPhone it's called Notes. And you can type, there's also a talk to text feature. So you could leave audio recordings in your notes. I just like the notes because you can organize them in folders.
Okay, thank you. And this next question is for the patients, either one of you, if you're willing to share. What was your darkest moment and how did you overcome it?
You can go ahead, Blake.
All right. Yeah, I mean, I remember back when after I got my surgery and I was, back in North Carolina, I had lost my health insurance. So it was about a month and a half of me just, doom scrolling and Googling everything on my own, trying to get into a hospital. I mean, to see someone for follow-up care. And it's one of the reasons I went to UNC, because they were so open and just like listening. And I actually got in to see a doctor like Dr. Shen and Dr. Hagi back then. I was able to just jump on a Zoom chat with them and get a plan. But it was a pretty dark time there for a while where all I had were those statistics. And, I hadn't yet connected with anyone who was a long-term survivor. So I was just in my own head. And I had that moment of, it would be so much easier to just let it go, right? And just fall into that, whatever that is, and stop trying so hard. But then it's exactly, what Christina was talking about, what Neil was talking about. It's all those people and all that support around us. I was like, it's like going outside of your life. Like my life is built on the amazing people I've got to surround myself with. And I'm just so grateful and floored by that every single day. But in those darkest times, in those earliest days, it really was the people around me who were willing to believe in me before I had that belief in myself, to keep showing up and to keep, not even just putting on a smile, right? Because at that point it was genuine. It's like, no, I do have all these things to live for. And, writing all those down, I wrote it on a note card and I kept it in my pocket. So whenever I felt that dark place coming on, I would pull out my list and I'd be like, no, these are the things I'm living for. Like, this is what matters. And it was a list of all those people that had supported me and were there for me. And, and that was a huge part of it. And then goals for the future, of course, was also part of it. But at the top was definitely all those people. So yeah, that's what really helped me.
And then this last question is for our physicians. Are there any new advances or treatments within brain cancer?
Yes, I will take that, Holly. I'm very, very excited to share that we are starting a phase 1 clinical trial for patients with recurrent or refractory glioblastoma, where we are using CAR T to target an antigen that is known to be present in brain tumors. It's going to be the first clinical trial of its kind in the Carolinas, and one of the 2 clinical trials in all of USA, which will be recruiting patients once it starts. So we will be engineering, and it gets a little technical here, but it's important to know that we'll be engineering B7H3 specific chimeric antigen receptors. And I'm very excited to share that these are not commercial CAR Ts. These will be manufactured here at UNC in our cellular therapeutics lab. And they'll be engineered specifically for the patient's brain tumors, and will be given intraventricularly through an Ommaya reservoir that will be placed in their ventricle. And the goal is to see if these CAR Ts help fight GBM. There is some preliminary data from other centers, and they've shared some really, really fantastic results. So we are very, very fortunate that at UNC we have the scientists, the engineers, and the facility to make these CAR Ts that'll definitely benefit not only the patients of both North and South Carolina, but will also help take the field forward.
Yeah, that's great, Dr. Ralph. And I just want to add to the, Dr. Shen and Dr. Ralph and others myself included, and Dr. Richardson, there have been both the quality and the quantity of life research at UNC. So Dr. Ralph talked about specific CAR T, which is an oncologic treatment to hopefully extend the survival of patients. There's lots of work that Dr. Shen is doing on understanding cognitive outcomes, work that we're doing looking at modifiable treatment preferences to help strike the right balance between quantity of life and quality of life that's individualized to the patient. So both molecular, personalized treatments, and also sort of on the clinical realm to really create a sort of a patient-specific care model that I think really embodies what we've been trying to do at UNC for so long, and now putting it to research and getting it funded and accelerating it is really exciting. So yeah, thank you.
Well, thank you all for your time today and for this incredibly important conversation. As I mentioned before, you are all an inspiration and the reason why we do what we do each and every day. We encourage all of our guests to fill out the survey that is below to share your thoughts on any future events that you would like to learn about. And then we also have some resources here listed on this slide. If you have been inspired by what you have heard today, or if you would like to learn more about many of the things that we discussed, you may click on these links to learn more about these programs. And my contact information is listed as well if you are interested in supporting any of these initiatives or continuing the conversation. Thank you so much for your time, and we hope you have a wonderful evening.